So this is just going to be another interview. This one's pretty short, so we can keep it brief. But this is going to be with Anne Frecco Raffo, MD, and Bradley Alder, MD. So the interviewer's addressing one of the main topics here that I've been talking about with the current healthcare system, which is that doctors are going to be feeling burned out and have a limited amount of time with these excessive patient loads. The question is asked for them to describe their practices. Both of these providers switched to a concierge medical system, and the question was asked for them to describe their practices before switching. Raffo described it as having a lot of patients every day, with a waiting room that was filled with patients at all times. They're typically running late because the patients didn't come in. And when they did, they had multiple questions or concerns. So it led to a lot of stress among the staff and providers, and patients were not satisfied. And they were just basically feeling like they were rushed all the time. The other provider in this interview agreed with how his practice was before switching, essentially just saying that there was never enough time to see his patients. Then the question was asked, why did they make this switch to concierge medicine? So they basically just elaborated on the same reasons as before, that there was this excessive amount of burnout because of the patient load, that there was never enough time to see the patients in any sort of sustainable way. Okay, and then the interviewer then asked them to describe how their practice has changed, what it's like today. It's basically they're saying that it's become much calmer. They feel like their patient care has increased, and they've been able to see patients much quicker, or even just speak to them on the phone if that's all they need. One of the interesting distinctions that they bring up here is that they feel that they're able to focus more as physicians on illness prevention as opposed to just treating symptoms. They said that before it felt like they were just putting Band-Aids on everything and putting out fires all the time. So I think that speaks to the state of our current healthcare system and how we're not really treating each patient as an individual or as a whole. We're more so just treating whatever symptoms they're having just to move on and get to the next person as quickly as possible.